Greg Tod, physical therapist, clinic director of Renewal Rehabilitation. Yesterday, I posed a question to many people in a DPT group about what they expect their starting salary to be because of the meeting that I had this morning. And I appreciate everybody for answering those questions. And honestly, the salaries were varied, but it wasn't anything outlandish. And basically, I realize now that there's a little bit of a disconnect, not with the salaries. It's just understanding the expectations of what you need to get paid versus what is expected for you to produce and what the company that you're interviewing for is bringing in. So with that said, I literally just created this like 5 minutes ago, but I think this is going to be a simple way of just showing you guys some of the things that you need to be looking at when you are interviewing for a job, and questions you need to be asking besides the typical, what's my benefits going to be? How much money are you going to give me for continuing ed? If money is a big thing for you, you need to be asking certain questions. And if you can't get those answers from the employer that you're interviewing for, then you're with the wrong employer. Okay, so hopefully this makes sense. I'm going to try to make this as quick as possible. All right, this is what I did. I literally just did this on my iPad. The first column is just the hours that you're working per week. I'm just assuming everybody wants to work 40 hours per week because you just went to school for like 80 years to become a physical therapist. So I'm assuming you all want to work 40 hours a week, right? You want to work full time. Now, there are a few variables that you're in control of, and that is how many patients you see per hour. Some places want you to see 1 an hour. Some places want you to see up to, 2 an hour, okay? Basically, whatever it is, that is going to dictate how much you get paid. Now, when I'm talking about this, guys, I'm talking about this from an outpatient physical therapy standpoint because that's the environment that I've worked in for the last 15 years. I've worked in outpatient physical therapy. I've been a clinic director for corporations, 3 corporations, before I owned my own one for the last 10 and a half years. So that's what I want you to look at in this column, okay? How many patients are you seeing per hour? Now, there might be something that you're comfortable with. Maybe you only want to treat 1 an hour, but maybe you're somebody that thrives off of volume, okay? And you are willing to see 2 an hour. That's going to dictate how much you're going to get paid. This column is very important, and that's something you need to be asking your prospective employer. What is the average revenue per patient? Meaning, what are they averaging for every single patient that's coming in the door? Not every patient is going to be the same, but some clinics see a lot of Medicare. Some clinics see a lot of private insurance. Some clinics do a lot of self-pay. Some clinics see a lot of auto. Whatever that number is, that is going to change the game for you. And if your employer can't answer that question, then a red flag should come up in your head. Like, do they just not know it and they're just not savvy with their business and they're not paying attention to these things? Or are they trying to hide something from me? This is a very important question to ask. What is the average revenue per patient? Now, if we know all these numbers here, we know that we're working 40 hours a week. We know that we're going to see 1 patient an hour. And I just did 2 examples. I just showed you what the difference is between $70 per visit and $80 per visit per patient. And basically, here's what it comes up to. This column right here is what you are generating per week. If you are a 40-hour work week physical therapist, you're seeing 1 visit an hour. You're generating, basically, the average is $70 per visit. That means that you're generating every week for 40 hours, $2,800 for the clinic that you work for. Now, this column, let's talk about this. The fact is that it's a business. You don't get all the money. You're going to get about 30% of it. Now, that's going to vary. It's going to vary on clinics. Private practice doesn't have as much overhead, not as much people up the ladder that have to be paid, so that might be closer to 60. Big corporations, that might be closer to 50 or right under 50 because they got CFO, CEO, marketing person, this person, IT guy, blah, blah. Everybody's got to get paid. So basically, physical therapists of the organization, physical therapists are going to be the ones that are going to get the most percentage of it, okay? But you've got your office manager. You might have techs. You might have PTAs. You're going to get about 30% of whatever you generate. So if you're seeing one patient an hour, you're working 40 hours a week, and the revenue is $70 per visit, you're generating $2,800 for them, and 30% of that is $840 a week. In a 52-week year, that means that you'd be making $43,680. Now, I know that's really low, but do you see how the difference with what if we did the exact same thing, but that company generates $80 per visit? Well, it's going to be more like $49,920. Okay? Now, that's on the very low end. But somebody in the group actually said a pediatric place was offering them in the 40s. The reason why is because with peds, most of the time you're having to see these kids one-on-one. That's the reason why it's so low. Okay? Now, let's look at, all the way on the flip side. Let's say you're seeing 2 patients an hour. Every hour, that's what you were averaging. And let's just say that it was $70 per visit that they were averaging at that facility. That means that you're generating for them $5,600 per week. 30% of that is $1,680. You know what that comes up to? That comes up to, on a 52-week year, that's $87,360. If that same clinic, you're doing the same amount of productivity, and it's $80 per visit is what they're averaging, you could be a $100,000 a year therapist. That's the things that you guys need to be looking at. There's certain questions that I don't think you're asking, and then that's what leaves new therapists frustrated. I actually see therapists that are 7-8 years out of school not asking these questions because not understanding the dynamics of how the clinic works. So you got to understand, if you're working for a big corporation, maybe this number is going to be a little bit lower because other people have to be paid. You're working for a smaller place, you want to make sure that they have their finances in order and that they are collecting what they're supposed to collect. If not, that's going to hurt you. You're going to be working a lot harder and not getting as much as what you should earn and deserve. But when you start talking to me about, hey, this is what I'm willing to see, now you have some play with what you can demand from, certain organizations. So anyways, I hope that helps. And we'll talk later. Deuces.